Good evening. Welcome to Odd Jobs, the show about occupations. We have a guest tonight that we are incredibly excited about. So happy to have her. We have Maryann Barbour here with us to talk with us about her profession. Good evening. Thanks for coming on.
Hey, Nick, thanks for having me. I'm honored.
Well, thank you. Thank
I
you.
love your series. Very informative, laid back. I watch them all.
Well, thank you. That's great. So tell us, what do you do?
Well, I've been in nursing for 41 years. I'm a registered nurse and I'm certified in rehabilitation nursing and brain injury nursing. Um, I am presently working as a triage nurse, which is sort of a new concept, and I can tell you more about that later. Yeah, but I've been in rehab nursing for 32 years. So I can probably best speak to that and tell you
Sure.
about my experiences there.
Give us the responsibilities that come with what you do.
As I mentioned, I've worked for quite some time on inpatient rehab, and I work for a large local healthcare system on a acute inpatient rehab unit, and on the spinal cord and brain injury team. So there's a lot of aspects to that. A typical day on a unit as a bedside nurse would entail just all aspects of patient care, physical, mental, emotional. You start your day giving medications, which really isn't that simple as it sounds. You have to assess patients' lab values, vital signs, any physician's orders that may have come in.
Right.
So that's always a big task, and that's kind of throughout the day, whether oral or IV or other routes.
Right, sure.
And generally any treatments, anything from wound care to tube feedings, EKGs, IVs, pain management, of course, carrying out physicians' orders, and keeping them informed, sometimes correcting mistakes.
Sure.
And certainly monitoring for any changes in the patient's conditions. They can be very subtle, and you have to anticipate what may be coming.
Right.
So excellent assessment and critical thinking skills are certainly necessary. And,
Right.
with experience, you develop those
Right.
skills as well. There's a lot of patient education, not only for patients, but for families, because they're going to be the caregivers when the patients, when the patients go home. You really have to be a good team player because there's so many disciplines involved on inpatient care. There's other nurses, on other shifts. There's CNAs, which are probably the hardest working in the field of medical professionals, the CNAs. Of course, the physicians, therapists, social workers, respiratory therapists. But usually the nurse is the one who's coordinating all those things.
Wow.
So and that's a big part of rehab nursing. Of course, the goal is to help the patient reach their most independent level of functioning after an injury, especially on the brain injury or spinal cord team. You work with an interdisciplinary team, the physical therapist, occupational, speech, recreational therapist, social workers, case managers. It's really a team effort to get that patient where they need to be for discharge. My true love lies in brain injury and caring for those patients. But I could talk on that for hours. So that's maybe a whole different interview when you're famous
we'll
and
have
doing your
part two.
blogs.
Good.
Yeah, but right now, so I'm in triage nursing, and I think for about a year and a half I've done that.
Okay.
And there are, I believe, 12 RNs that we have at the center that I'm at, and we triage patients by telephone. So that's very challenging.
Right.
You can't do hands-on, you don't have your stethoscope, you're not
Right.
actually seeing the patient, all the information's kind of subjective.
Right.
But I really think that, this is kind of a new concept in nursing,
Mm.
and it is uh, probably somewhat of the future of
Sure.
nursing with virtual appointments, especially in this COVID
Right.
era.
Gosh.
But we take calls for, I think, 12 practices, which
Okay.
I think encompasses about 70 or so physicians.
Wow.
And all of the nurses at my center, which is through our large healthcare system.
Sure.
We all have probably 20 to 40 years experience. So you really do need that experience in, triaging someone without seeing them.
Right. Goodness.
um, yeah, so that's pretty much what I do. And we also, we refill prescriptions, we give
Right.
them lab values. We still do a lot of education as far as preventative care.
Sure.
Patients may call for anything from I'm having chest pain, stroke symptoms,
Mm.
to a tick bite and what to do.
Right.
So
Goodness.
there's a lot of uh, we can tell patients you need to get to the emergency room. We call
Right.
911 for them, or
Oh.
we schedule patient appointments in the appropriate time frame.
Right.
Yeah, so it's we also manage a community line for patients without physicians,
Okay. Wow.
and we presently are managing a COVID line as
I'm
well.
sure.
Yeah.
Goodness gracious.
We
The
give, we do refill, we refill prescriptions, give lab values, anything a patient may call their PCP on.
Sure.
Yeah.
It's they for that new concept triage, they couldn't have found a better one to employ that deploy that new concept with. So they found a
Right.
good one.
You say all the right things.
Right. I try. Yeah. So what type of prerequisites come into play, or how do you prepare for these things?
Well, I think most of at least the large healthcare systems require a BSN now.
Okay.
Yeah, I have my associates, and along with my certifications.
Sure.
But I think there's just so many venues of nursing that
Right.
require different things. But I think it's a good idea now to go ahead and just go forward and get your BSN and go from there.
Sure.
Yeah.
Gosh. Have you always wanted to go into nursing?
I think so. My father, who passed in 81, was sick from or when I was young at an early age. So, and at his young age as well. So I think I was always exposed to hospitals and visiting him at hospitals. So,
Right.
I think I just got to experience that environment and see how the nurses were so knowledgeable and
Right.
compassionate and took such good care of my dad. So yeah, I think that's what kind of guided me at an early age into that.
Sure.
Yeah.
Gosh. So was there a certain aha moment that knew your current position was going to be the next role in your career?
Well, I think overall in nursing, my sister's a retired nurse, and my mother is she's retired, but she was a home health aide.
Right.
So I think just watching them throughout the years and listening to their stories and seeing how is how they just always went above and beyond,
Right.
their realm of care.
Sure.
Just really inspired me. My mom and sister really inspired me to go into nursing. Yeah.
Gosh, I've met them. They're great ladies. If anyone has the opportunity to meet either of those two, be a good day.
Yeah, they are. They certainly are.
So if someone's out there and they're listening to this and they think that is something that I would love to go into, what would you suggest for a couple of their next steps to be?
Oh, well, I think, it's kind of probably cliche, but, you really have to know that's what you want to do.
Sure.
So you can, if you can volunteer at a hospital or maybe get your CNA first, just make sure that you're willing, that's what you want to do, because
Sure.
you're seeing people at their rawest.
Right.
They are they are sick, they're anxious, they're scared, they don't want to be in the hospital, they're anxious, and
Sure.
so um, it's an honorable profession,
Right.
but it's not for the weak
Sure.
at heart, because you're also seeing people at their most vulnerable moments. And so I think I would make sure that is a profession that you want to get into. It's certainly not glamorous. and you're dealing with certainly with healing patients, but also with death and dying. And you get very attached to a lot of these patients, especially in rehab, when the patient, you may have that patient for 2-3 weeks, and the families as well. So I would make sure there are I would go ahead now, like I said, that there are most larger healthcare systems require BSN.
Sure.
So I would just go straight through. I would just go for that. A lot of the systems also have what they call the academy, where you can, work for a length of time on different units. There's so many different venues for nursing, different, not only care facilities, but there's med surg, there's ICU, there's rehab, there's too many to name, really. But this academy lets you experience what may be the best fit for you.
Nice. Wow.
Yeah.
It's a job where there's a lot of people working together for the common good. And nurses are some of the best folks in the world. Everyone I know is an incredible person. And man, it's like you said, it's not for the weak of heart. But when any place that finds a good nurse, boy, they found a treasure. But anyway, we appreciate you coming on today and sharing all the insights and all the great information, educational, inspirational information that you shared.
Well, thanks, Nick. And again, thanks for having me. This is really a good series. I appreciate you letting me be part of it.
Of course, of course. Well, we wish everybody out there a wonderful, happy, and healthy evening. Good night.